So, on today's podcast, I talked to Dr. Huey, who is an integrative medicine doctor. He is he practices Chinese medicine and Western medicine, and he brings those together. And he actually brought integrative medicine to UCLA. He was one of the first doctors to do that. And it's a fascinating talk because we talk about how the difference between the approach of Chinese medicine and Western medicine and the benefits of both. You know, Western medicine is fantastic at fixing the thing, but Chinese medicine looks at the whole person. It looks at the integration. It looks at your stress level. It looks at your diet. It looks at your exercise. It looks at your posture. And really what I love about Chinese medicine is that there's a big education component. You learn a lot about yourself. He talked about diet, how even within a family, not everybody is going to respond the same to the same meal. And so we're all individuals. So I hope you tune into this. I hope that and I know you will learn something. I'm fascinated by Chinese medicine and the integration with Western medicine, and Dr. Huey is the leader in this area. So you're in for a treat, and I hope you enjoy. Today's podcast, California Natural Living, we will be speaking with a renowned UCLA doctor to learn how to integrate Eastern and Western medicine. We're going to talk about how you can safeguard yourself and your family from the overstressed world we live in. If you're feeling stressed, welcome to the modern human world. Dr. Huey is a professor and director of the UCLA Center for East-West Medicine, which he founded in 1993. The center is one of the first integrative medicine centers in the United States. Dr. Huey is an internationally acclaimed educator and researcher. Since the 1990s, Dr. Huey has served as an advisor to the World Health Organization. If you would like to follow East-West Medicine on Instagram, their handle is at UCLACEWM. Welcome, Dr. Huey.
Hi, thank you, Jessica.
Thank you. First, thank you for agreeing to do this podcast. Before we start, I want to make a little disclosure that I do go to your East-West clinic, and one of your doctors, Dr. Katie Hu, is my primary care doctor. So we know each other.
Thank you very much for trusting, with your health care.
Actually, I wouldn't trust anybody else with my healthcare. I have such confidence in everything that you and your team does that I am just thrilled to be able to see you. Now, traditional Chinese medicine views the body in a different way than Western medicine. And it's been around for over 3,000 years. Can you talk to us a little bit about, because you were one of the very first doctors, you're an MD and you're a Chinese doctor or a doctor of Chinese medicine. Why did you decide to integrate those? And can you just tell us a little bit about how they work together?
Well, this whole project started 50 some years ago when President Nixon went to China. When I first, while I was in medical school at UCLA, saw acupuncture for the first time being used during surgery. And then
in China or at UCLA?
No, in China. Well,
and so why did they use?
I have never seen acupuncture in my entire life growing up in Hong Kong. I came to UCLA late 68, started my chemistry degree at UCLA and started medical school, in 1971. And then on TV, I saw acupuncture being used during surgery. So I was studying neuroscience at that time. And I said, gee, let me find out what the heck is going on. So they are integrating Chinese and Western medicine to create a new medicine by sort of using acupuncture, which we all now know is very good for pain, but they also use it during surgery, before, during, and after. So
And
they,
do you know what the purpose was? What were they trying to accomplish by doing that?
well, obviously, you can decrease less use of anesthetic so that you recover a lot faster. But obviously, this is sort of how it led me into understanding that since 1955, China already embarked on blending the two medicines together to create a new one. So I thought that, well, as a young medical student studying Western medicine, biomedicine at UCLA, wouldn't it be nice for me to see what they're doing while I learn all the latest through the platform of UCLA School of Medicine? So this has been my 50-year project.
Wow.
So let me just say something about like the major differences
Yes.
between the Western biomedicine with traditional Chinese medicine. Obviously, we are very technologically advanced with Western medicine. Chinese medicine, they are now doing the modernization, but on the whole, it's still very, I would say, ancient, but could be also very advanced in some of the ideas that you do not separate the body into different parts. First, you don't separate the body and the mind and the spirit. And then secondly, you recognize the like whole systems approach to health, and also looking at the climate as well. So what I see, the integrated East-West approach is very useful when we try to deal with climate change as well.
When you say climate, you actually literally mean the climate that you live in, not the climate of your body, just like if it's cold, if it's hot, that's what you're talking about?
No, climate in terms of like when the weather changes
Right.
during the various seasons or during
Why
the
does that affect us as people?
Well, the Chinese think about the body as a functional, but also an energetic system, less on the anatomic, which really defines, Western medicine quite a bit, obviously with surgery. So now we are moving into the chemical basis with the drug treatment and so on. But Chinese medicine has always looking at the whole system in terms of energy and function, and less on anatomy because of the Chinese culture of not harming the body, try not to have surgery, as much as possible. So in a sense, they basically have to use their clinical skills to try to understand what is going on, and then try to look at, rather than a disease part, they look at what is abnormal physiology, that is our balance.
Okay.
So in the Western medicine, terminology, we talk about sort of the autonomic nervous system, the endocrine system, the immunological system, and
We're separating the Western medicine kind of
right.
separates all the
Whereas the
systems.
Chinese medicine always look at the outcome. So that's why it's a much more pragmatic type of approach of looking at where is the dysregulation that lead to the imbalance. Why is the body not able to maintain the balance?
Right.
And so that's why it's very important for young people to optimize their health before they conceive, to give the best endowment to the child and to the baby, and then at the same time to try to kind of create an optimized type of environment for the baby as they grow up before they go to the outside world. So that's why we are focusing on now teaching young people to allow them, that you should optimize your health, because most of the young people now, with all the stress going on and the lifestyle that they are, living with, they are very depleted. They are so out of balance.
So balance is key, right? It's key to keep everything in balance. So we're talking today also, like a big subject I want to talk to you about is stress, because we live in a stressful world and everything that you said. So if one can keep their body in balance, does that help them battle the stress, or
Well, obviously, in Western medicine, we talk about the balance of clotting and bleeding, right? So clotting is what leads to people's heart attacks. The immune system is obviously when it's out of balance, it attacks the body, uh, and you can have hyper or hypothyroid with the endocrine system. So what we in Western medicine in general do is that we would replace, we would block, or we would stimulate. We stimulate when it's low. We would block when it's too much. Now, the key thing about the difference with Chinese medicine is that it tries to understand how to modulate, how to get rid of the stressor, which could be, in general, nowadays we know is the mental, the psychosocial, but it could be mechanical, our posture, with the head down all the time. That's a mechanical stress on the rest of the body. Or we're sitting down for too long, or we are exercising inappropriately, or we do not sort of have our optimal lifestyle, all night working and all these are stressors in addition to the usual mental health stressors like.
And what if you can't get rid of the stressor? So like, for instance, I'll give you an example of new parents. They have a brand new baby, and all of a sudden this baby is crying and now the parents are not sleeping and they're not eating, normally. And I mean, to me, that's that, and I've lived it. So I know that it's a very stressful situation. So how do parents regain their balance in that situation? What would you suggest?
Well, obviously, having a new baby is a major stressor, both mechanically, because you have to carry, them increasingly heavy, baby, and you have to bend down a lot, carrying them, from the bed or
And
put
if
them
they
in
have
the car seat.
colic and they're crying all the
They're
time?
crying all the time. So that's why you have to basically treat both the baby and the parents together as a whole unit. And
Yes.
that's why we're trying to build a family-based in pediatric program, is that you cannot just treat the baby without treating the parents.
Well,
Because the
I know that
parents,
you believe in family, right? You believe in you have to treat the whole family. So it's actually an extension of the kind of the Chinese looking at the whole person, but then you look at the whole family, which I always thought was fascinating because it's not just the baby, right? You have to treat everybody in the family or address it. Can you speak to that a little bit?
well, obviously, when the parents are not healthy, first of all, you may not give the best genetic endowment to the kid, right? If you have bad habits, you would also pass it on to the baby, because the parents would be a good model for the baby. And then obviously what you eat also may have implications, for the health of the baby as well. So that's the reason why. But again, if the baby is not well, crying and having illness, the parents cannot have the good night's sleep and they worry and so on. So you have to basically treat all three together. Or if the grandparents are involved, you have to treat everyone involved.
And then the dog. And
So
so
it's the system.
now yes. So now let's say this family came to you. What would you suggest? Like what's number one?
Well, you try to, I would say, treat the baby so that, when the baby is well, the parents would have the needed sleep. I give you an example. I have a fourth-year medical student who took our, course, and then, she looked very tired. I said, "What happened?" "Well, my baby's been crying. I have to move away from my husband who need to go to sleep." So what I taught her is to teach her how to massage her baby's neck area, the tummy, squeeze their feet,
Hmm.
and then the baby was able to go to sleep.
And what does that do when she does those massage points?
It would calm the baby down
Calm the baby down.
because
So
in
the
effect,
neck, the tummy, and the feet
yeah.
those are key points.
Well, those are important areas where I believe that have a lot of effect on the control systems.
Mm.
That's the reason why for the adults or for the adolescents, I say, watch your posture, your neck and your back. See, when you massage the calf and the feet, basically the nervous stimulation actually would relieve the back spasm, would relieve the neck spasm as well. And basically both the neck and the back are markers of ill health. So it's not just a orthopedic problem. It is oftentimes the tightness of the muscles there, and the tummy also is where the enteric nervous system, the little brain is there. So by massaging that area,
Getting it to
also,
calm down. So just trying to get that nervous system to calm down a little bit.
Exactly.
And then I feel like, and because you've told me this about myself too, make sure that if you get a massage, make sure they work your neck and your lower back. And I feel like because those are junctions, right? That maybe things can get clogged. Am I thinking about that correctly? Or why those 2 points for adults, let's say, in addition?
Well, nowadays, when we are like on the computer a lot, Zoom call or the iPad or the iPhone, or when we have heated discussion, our neck tightens up.
Yes.
And there's so many important organs in the neck, the nerves, particularly the nerves that regulate people's eye, their nose, their jaw, their tongue, their stomach. It controls blood pressure, controls heart rate. So by virtue of teaching people how to watch their posture upright, in our class, we'll talk about when you had your head down, working on your computer all the time, you're talking about 40 to 60 pounds of weight on those neck muscles, but because the body is linked, it go all the way down to the back as well. So in a sense, we really want people to recognize that the pain wants you, but some people with no pain, they have no non-pain symptoms of feeling nauseous, dry eye, watery eyes, and kind of
Are those also symptoms of pain? Are you saying like nausea and dry eyes? It's just not a traditional sense of pain, or like if those things are happening, it's a warning sign?
It's a warning sign because those are non-pain manifestations. And by virtue of having the muscles in the neck and the back not tight, and you can move normally with a normal range of motion, then it helps the nerve to calm down. Because when the nerve that make the muscle tight, it's not just affecting the muscles, it affects the other organs that they innervate, that they control. So that's why a lot of people with like reflux and bloating, many of those symptoms can be helped by working on the neck. And then what makes the neck tight? Obviously, our posture, driving for too long.
Stress, right? Stress.
Anger, right? But even just like a little motor vehicle accident can affect, that for a long time, because that's how the body is trying to react, So the so-called whiplash symptoms oftentimes are related to the neck, and you can make it, sort of common to many things that make the neck tight, like even having cold air blow at your neck, the air conditioner, or I've seen people who get their Bell's palsy, the third nerve palsy. There even another patient who get third nerve palsy affected the eye.
And you feel that is from
the tight neck
from the tight neck.
To it. What leads to the tight neck? Because the neck muscles clamp down. It affects the blood supply.
So everything, it sounds like everything is interconnected. I mean, for me, this is a very new concept for me. I mean, now that I've, started to learn all of this, I really do understand and I have seen that everything is connected. I remember when I was talking to Dr. Who, she was telling me that my IT band was tight and that would affect my digestion. And to me, these are two separate body parts. So why would my IT affect my digestion?
Well, obviously, the IT band relates to the sciatic nerve, because the body is an intertwined whole system.
Yeah.
It's not, we regard them as different anatomic parts. And that's what we are learning over the last 100 years, that the surgeon would look at the different parts, but at the physiological level, at the biochemical level, they are all linked together. So that's the reason why usually if your IT band is tight, your neck will be tight as well. In Chinese medicine, the gallbladder meridian. Okay, so that's the reason why even when patients have sciatica, and X-ray may not show anything that is bad, in the lumbar spine, but it could be just from posture or from sort of mental health stress.
And so I want to ask you a question that is a very big question that we get a lot. And a lot of people today have eczema. And I did talk to, I did a podcast with Dr. Hu, and we talked about eczema, and she talked about stress, and that, and now I think Western medicine looks at eczema strictly as a topical skin disease. If you go to a dermatologist, they'll give you a topical steroid. So how does Chinese medicine and or integrated medicine with the East-West, would you first give a steroid just to stop it and then work on the cause? Like, what would your approach be to eczema, either for babies or for adults? Because are they different for babies and adults, or is it just eczema is a thing for everybody?
I think that eczema is inflammation of the skin, and so anything that leads to inflammation, if it appears in the skin, you have to worry that the inflammation will be occurring in the rest of the body. It may be linked that, people may not know that it may already be in the gut area. It could be very minor, but maybe it's just so obvious when it's in the skin.
Right, because you're looking at it, it's not hidden in your body.
Exactly. And so what we try to do is to see, well, what is in the diet that is pro-inflammation. So that's why both East-West would agree on a anti-inflammatory diet.
Okay.
And then secondly, it's also related to, I would say, mental stress. Okay, mental stress. The Chinese would look at like a lot of the skin rashes as too much heat in the system. And that's
trying to escape, the body's trying to get rid of the heat.
Except, so in a sense, when it's really bad, yes, you use a little bit of steroids to suppress it, but that's basically the difference between East and West. West would always focus on the symptom. They zero in, they target the symptom, they make it go away. But if you do not change what leads to it, why it leads to it, then it would keep coming back. So you have to keep using it. So what
and then it stops becoming effective after a while anyway, right? We know that steroids stop.
The dose, the strength, you escalate to even more potent medications, right? I have a student who has 13 years of very bad, eczema in the face that since really teenager years. And so after she took our summer course, she learned about the effect of stress and stress relations to inflammation. And by changing her lifestyle, obviously as a college student, you're under a lot of stress. And that's why we want people to know how to cope with the stress that they cannot avoid. So avoid what you can, but then try to do something that would negate the negative effects of the stress on the person. And so it's more than just the eczema, just because sometimes you see this person for the stomach problem with the IBS, you see the dermatologist, you see maybe even a rheumatologist for autoimmune diseases, or so on and so forth. So, or migraine headaches and so on. So that's what we see in our clinic. But when they come in, we look at the person. We try to help them sort of learn ways that they would hold their head, their body, the way they exercise, the way they eat, what type of food they eat, to eat regularly. Because oftentimes, they have like, very poor eating, habits, and they eat a lot of fast food, right? So oftentimes when we work with, our patients, we basically try to understand the person as much as possible. Oftentimes, it could be many, many years of, I would say, post-traumatic stress that, we need to at least address as well. So it's
So
really,
you look at stress and trauma, right? Because I feel like trauma is something that people are starting to understand now. Before we thought trauma was over there somewhere else.
only people who come back from, the Middle East, the wounded
Right, from
warriors,
war,
right?
veterans.
But really, I mean, like but right now, I would say that so many people are traumatized during these last two
From COVID, you're saying that people have,
from COVID, or just like witnessing something, right? Even like some family members with serious illness, that could be quite traumatic depending on the person. If some person has good resilience, okay, in Chinese medicine, these people have a lot of like qi, not too much, not too little, but they are able to withstand the stressors. So, but for some people, the same, stressor can lead to different sort of manifestations.
and do those things live in the body? Are you saying like that stress now kind of finds a home in the body? And then also, if it does, can we release that?
Well, see, that's why I think last month we have a trauma retreat to help young people to look at, what are some of the things that they have encountered in their life journey. Some, may not even know, like when they were too young to remember. Even adults, after a car accident that require hospitalization. And this patient came to me with like all the headaches and sinus problems. And what happened is that she did not even remember that, her headache actually intensified after that accident. But some people basically may suppress some of the adverse childhood experiences as well. And when
It's a
we,
survival mechanism, isn't it? Wouldn't you say that we?
oh yes, but oftentimes very easily some of that may be rekindled. And
Yeah.
then that's why a lot of people cannot even go to work at all, to maintain a good livelihood.
We were talking about your student who had eczema and she went to one of your classes and she learned how to take care of herself and all that. Did she ultimately, was she able to get rid
She
of it?
was going to be on very strong steroids. She already has been
She
on
came to
steroids.
you with on strong steroids.
Steroids,
Uh-huh.
yeah. And then now she has a beautiful face without, the mask and so on. And then,
Wow.
just learning how to do not just acupuncture, because we teach our patients you're afraid of needles or they cannot come to us. Just use the TENS unit, use your hand to massage certain acupoints. We teach them how to use the tennis ball to massage, the upper part of your body all the way down to your low back and your hip, and use the golf ball to massage the bottom of their feet. So when we try to help people to re-regulate and make sure that the muscles are not tight. So there are different symptoms, including pain. And when they come in, we make sure that they do the right stretching. We teach them how to do Qigong, do the right type of yoga for them, have the right kind of exercise, have the right kind of diet.
I would love for you to just talk about that because that was a surprise for me when you said people are doing the wrong type of exercise. Because I feel like in the Western world, we don't think that the exercise is not correct for us. We think exercise is exercise and we all should be doing the same. So that was a surprise to me when I heard you say, that somebody's doing the wrong type of exercise. What does that mean?
Well, exercise is good. Just start moving. But sometimes, when people already work, in a very stressful environment, at the end of the day, they are so depleted, they will go run and run and run and run.
And deplete themselves further, right?
So or they would do like weightlifting when
Heavy weightlifting.
yeah, right. So that should not be, the right kind of exercise. So their muscles are already so tight. We want them to do more stretching exercises that would be more useful, calming type of exercise. That's why we recommend them to do like 8 Qigong. The 8 Qigong involves like moving. It's kind of a moving meditation. It involves stretching. Yoga is good in general. I recommend it for young people, but then you have to lie down or you have to find some, place to do, the yoga poses and stuff like that. Whereas I think that what I don't want people to do is to have loading exercises. So even for yoga, if people don't do the down dog pose, they actually can create like, tension.
More tension than probably like in their neck and shoulders if they can't hold that weight.
Exactly.
You know what I really do love? I think Qigong is really an incredible exercise, and it's very like, well, it's not quite an exercise. It's a lot of different things. And I think a lot of people don't know about it. I've just started to learn more about it, and I just think it's great. It's energy work. It's a moving meditation. I mean, it's really sophisticated when you think about it. It's simple, but it also, like, after I do a session of Qigong, I have somebody that I work with. I have energy running through up and down my body. I feel kind of weightless, and I just feel renewed. So can you just talk a little bit and educate people about what Qigong is? Because they should be doing it.
Well, first of all, the concept of qi is so central, not just in.
And now qi just means the energy. Is that, can you break that down?
Well, let me try to break it down, because
Okay.
I think that Chinese culture talk about qi, and that qi gong, the word gong meaning work. Okay.
Okay.
So now I think this would be a good way to try to explain that we all recognize the importance of energy.
Right.
We all recognize the importance of energy with the neurotransmission. Okay, how do we define like death in Western medicine? Is flat EEG or flat EKG, right? So at the end of the day, you draw blood work, is all normal, but you are tired.
Right.
And some people go see a doctor, like, everything seems to be okay, but basically you are low in qi, or your qi is not flowing normally.
Or it's imbalanced.
So
Right.
first of all, one is the imbalance, and the other is the amount of qi that you have is to maintain the balance and the flow. And the highest level of that qi is your spirit. That's why you can see in someone's eyes whether, they are very spirited. Most people are dispirited. And when we have people with Alzheimer's, they are basically almost like no spirit in their eyes. So when people are depressed, they are very dispirited. You can just watch someone and you can, see it. So in a sense, the Chinese concept of qi is so important that we now want to teach a lot of the Western MDs trained in Western medicine, that we go from saving people's lives with their structural problems or with very bad biochemical, physiological imbalances, to recognize it even earlier at the qi level. So that's why when I teach, the residents, I said, look, when your muscle is tight, it's because there is stagnation. Qi is not flowing. Make the muscle tight. So qi going to help things flow.
So do tight muscles stop the qi from flowing?
Well, it's the qi, it's the other way around. It's the qi not flowing normally that make the muscles tight.
Oh.
It also affects your gut function. It affects many functions, because qi is described as the qi of different organ network. We don't just talk about the heart, but heart qi, the spleen qi. But basically, there's a lot of people who lost in the translation of some of the terms, because the Chinese description of some of the the organ network is some slight overlap with the Western, anatomic, biomedical, terms, but
Do you
really,
think we need to learn a new language for this? As
well,
Americans, I mean, because we
we,
think a certain way,
well,
or Western
we
medicine.
have been teaching like in the medical school since 1995, our medical students. So there are a lot of overlap between the two medicines. And all we need to do is to help them learn the basic, very basic language. We basically started teaching medical students since 1995, 96. So by about 12 years ago, 13 years ago, we have taken this course and make it available for undergraduates. But because it's during the summer, anyone can take the course. And we initially have physicians. We still have actually physicians who take the course, but then the majority of people would be UCLA undergraduate. And then they range from people who just graduate all the way
So
to
not medical students, just an
no,
undergrad.
because we basically try to, because I really believe that once they get into medical school, very few of them actually would invest a lot of their time, like my fellows who now run the various clinics. But we want everyone to have a good understanding about why it's important to extend our understanding about health and disease, because I believe that Chinese medicine have thousands of years of talking about health cultivation, and that we want everyone who will be in different sectors of society, just like someone like you, who really are helping people, to maintain health, starting at the baby level. We want to do it even before people conceive. So I want the young people to learn it.
So young people, students, mothers, maybe women who are
Mothers,
wanting
yeah,
to get pregnant
I have
in
retired,
preparation.
I have retired actually a housewife, to take it as well. But in nurses, I have
Nurses,
like
yeah.
other, healthcare professionals, but really this course is for everyone who want to better their health or even their life by having a new philosophy of life, through learning, this material. And that so it's really what I'm going to try to do is to make this available. Besides working on this material for the course, we are developing more material for young kids and adolescents, for the young family.
That's so important.
Because I now move from geriatrics to pediatrics because I think that that's the best preventive medicine.
Yes, it's preventative. Now, if somebody signs up for this course, it's online. Is that correct? Is it a Zoom type
The whole
course?
thing is online. The whole thing is online. We basically have 21 recorded lectures for people.
And can they save those lectures and go back to them? Or is it just like a live
I think
stream? So
it's
even if
not,
they sign up a little bit late, they will still be able to go back and go over material and have
like
that available.
the 21 hours actually is pre-recorded.
Okay.
The live sessions are every Wednesday from 5 to 6:30.
Okay.
What we do is to have more interactive activities and some demonstration.
And you will be leading it? Are you the one who will be leading?
Well, I will be Dr. Grant Chu, who is actually trained in both Western medicine, internal medicine, that also have a degree in Chinese medicine. Dr. Katie Hu would be going through a wellness plan.
Okay.
We also have a new, this is a new session to this time is to try to look at your constitution by looking at your constitution, not in the political sense, but your body constitution, because
everybody is individual. You're saying everybody. So I should look at myself. Everybody should look at themselves. They need to know themselves.
Right. They need to know themselves, because what is good for you may not be even good for your spouse, may not be good for your kid. So each one, that's why it's not an average good diet. So,
right.
And then some of the argued points that may be used for people to learn how to do a massage or stimulation. So that's the reason why we also have a sub-health, because most people they may not have a labeled diseases that they take pills, but they're not well. So we also have a self-help survey that we want people to try to look at, like,
So
what are
that self-help survey gets them to their constitution, so they get to understand their constitution. Is that
they
what that
understand the
does?
constitution. They also understand like how well they are, because a lot of people, they are
Everybody thinks they're
sick.
fine. Everybody thinks they're so healthy.
Yeah, they think so. But when that's why we have one video of college kids who pay attention to their health.
Yes.
And then when we,
I remember that video. That actually,
right.
everybody, if you go to UCLA and you search that, it's a really fantastic video, because you're going out and you're talking to the students and you're saying kind of some questions about like, so do you think you're healthy? And they're like, yeah, I'm healthy. And then you point at, like, let's say maybe you look at their tongue or something like that. You point out how that's an imbalance, and they have a look of shock on their face, like, oh.
But then you touch them, they say, ouch, I didn't even know that area hurts, right? Or like many of them have menstrual cramps, and they just.
Yeah. And that's, now, would you say that that is normal? I think for most women, they feel like, well, menstrual cramps come with the territory. Are you saying that's a bit of a sign of imbalance?
It is a sign of imbalance. That's why we try to teach them how to re-regulate the neuroendocrine and hopefully the immunological imbalance. That would be very helpful. And then a lot of the kids actually have unresolved childhood trauma.
Yes.
Half of them, right? So this is actually one of the reason, and many of them have low back problem, many of them have neck trouble, and even people like keep wearing their new glasses. It's not, this is a decline, and it can be prevented from its decline. So we really want to get people to understand eye health. We want to be able to know about oral health, how it relates to the rest of the body's health. So
it's so incredible what you're doing, Dr. Huey. Your work is incredible. You are incredible. I've just like, I'm so happy that I was able to even meet you and just learn from you. Every time you speak, I learn something new. I would love to do a couple more podcasts with you, and I would love to cover diet specifically, just one subject. I think that menstruation is incredible, a subject that, because as women and young girls, we're not taught these things, right? We're just kind of marketed to, and so I think it's really, really important that young women understand, what menstruation is basically saying to them and how they can regain balance. And then ultimately we can talk about trauma, which is a very, kind of big subject. But I hope you'll come back and we can talk about these subjects again in the future.
well, I will come back, but then obviously I have even better experts, who can cover this area, like, Dr. Katie, who obviously have talked about women's health. That will be part of our summer course as well.
Okay.
And eye health.
I didn't realize that. So you'll have to give us the expert. Maybe you direct us to the expert in each.
I would be happy to work with you. I mean, our work right now is to see that everyone during these very challenging times to learn some of the tools to help them handle the stress that oftentimes kind of aggravate some of the symptoms like eczema or their eye problem or their oral health, dental problem, or their skin problem. So,
well, I think it's a perfect time right now because we're coming out of COVID now, right? And so it would be horrible if people just went back to normal. I think it's an opportunity. I always look at stress times as an opportunity to grow and change. So I think your timing is perfect in the sense of like these classes, and I hope everybody takes them. And so
we're actually working on a film project.
Oh,
to
good.
try to actually address young people. What I see a very, very traumatic experience. Because oftentimes whether it's financial stress within the family, having to move away, having people who have loved ones sick, and so this is really what I would like to give back. I want to give back because I've been at UCLA since the late 60s, and I I'm of this age that I want to do what I can.
Well,
to
you're a
try
wealth
to-
of knowledge. I mean, you are a wealth of knowledge. You've got all of that.
Yeah, that's just how these two healing traditions can be put together, use it in the right way, help people how to navigate when to use what, and then train as many people as possible and try to make this available in different even languages. So we are translating some of our material into
Yes.
Spanish and train some Spanish speaking healthcare practitioners. And also we are also bringing because I really believe in EDI, and I really believe that we need to work together to have a better world with health at the personal level, at a family level, at a community level, at the global level. Because if we
Yes.
do not do something about it, we will we were doing disservice to our young people.
Yes. Well, with that, I'm going to thank you so much for being on the podcast today. And I look forward to welcoming you back on another podcast so we can do a deeper dive into each subject. That's a very Western approach, isn't it? Just to take one subject.
You can always talk about that one subject in
Yeah.
the context of the global. So like local and global.
Local. Okay. Thank you, Dr. Huey. I'll
Okay.
see you
Thank you so
again
much.
soon.
Okay.
Bye-bye.
Bye.